Have you ever felt that burning sensation in your chest after a meal? You're not alone. Today, we'll explore the causes of heartburn. Before we dive in, let's understand what heartburn is. It's a symptom of acid reflux, where stomach acid flows back into the esophagus. Heartburn is a sensation of burning and discomfort in the chest, often after eating. It's a symptom of acid reflux, which is when stomach acid or bile escapes from the stomach and irritates the lining of the esophagus. The esophagus is a long tube that carries food from the mouth to the stomach. Unlike the stomach, which has a protective lining, the esophagus is vulnerable to acid damage. Some of the main causes of heartburn are: one of the primary culprits of heartburn? Our diet. Spicy foods, especially those rich in capsaicin like chili peppers, can slow down digestion. This means food remains in the stomach longer, increasing the risk of acid reflux. Additionally, the heat and spiciness can directly irritate the sensitive esophagus lining, exacerbating heartburn symptoms. Fruits like oranges, lemons, grapefruits, and limes are naturally acidic. When consumed in large quantities, they can temporarily increase stomach acidity, leading to a higher likelihood of acid reflux episodes. Caffeine and carbonated drinks. Full circle caffeine, found in coffee, tea, and some sodas, stimulates acid production in the stomach. Carbonated drinks introduce gas into the stomach, increasing pressure and the risk of acid reflux. Both these beverages can also relax the less, making it easier for acid to escape. Beyond its caffeine content, chocolate contains theobromine, a compound that can relax the less. This, combined with its serotonin content, makes chocolate a potential heartburn trigger for some individuals. 2. Lifestyle causes. Beyond food, our habits play a role. Consuming large meals, especially before bedtime, can significantly increase stomach pressure. This makes it easier for stomach acid to flow back into the esophagus. Lying down immediately after eating means gravity isn't helping to keep the acid down, increasing reflux risk. Cigarette smoke contains numerous harmful compounds. Nicotine, in particular, can weaken the less. Additionally, smoking reduces saliva production, which plays a crucial role in neutralizing stomach acid and washing acid down into the stomach. Filled circle alcohol not only increases stomach acid production but also relaxes the less. Chronic alcohol consumption can damage the esophagus lining, making it more susceptible to the irritating effects of acid. 3. Medical causes. There are also underlying medical conditions that can lead to heartburn. Circle, a hiatal hernia is a condition where a portion of the stomach pushes upward through the diaphragm, a muscle separating the chest from the abdomen. This anatomical change can weaken the less, making acid reflux more likely. Gastroesophageal reflux disease, GERD. Full circle GERD is a more severe form of acid reflux that occurs frequently. It can lead to complications like esophagitis, inflammation of the esophagus, esophageal ulcers, and even a precancerous condition called Barrett's esophagus. Circle. As the fetus grows, it exerts more pressure on the stomach. Combined with hormonal changes that relax the less, many pregnant women experience heartburn, especially in the second and third trimesters. 4. Medications. Certain medications can also be the culprit. Aspirin and pain relievers. Filled circle NSAIDs, like aspirin, ibuprofen, and naproxen, can irritate the esophagus lining and increase stomach acid production. Overuse can lead to gastritis or stomach ulcers, which can exacerbate heartburn. Blood pressure medications. circle, certain antihypertensive drugs, especially calcium channel blockers and beta blockers, can relax the LES, increasing the risk of acid reflux. 5. Prevention and tips. Now that we know the causes, how can we prevent heartburn? Monitoring and adjusting one's diet is a proactive way to reduce heartburn. This includes identifying and avoiding personal trigger foods, and opting for smaller, more frequent meals to reduce stomach pressure. Elevate head while sleeping. Circle by raising the head 6 to 8 inches during sleep. Gravity assists in preventing acid from flowing back into the esophagus. This can be achieved with wedge pillows or adjustable beds. Clothing that constricts the waist or abdomen, like tight belts or high-waisted pants, can exert pressure on the stomach, pushing acid into the esophagus. Stay upright after eating. Circle after meals. It's beneficial to remain upright for at least 2 to 3 hours. This allows time for the stomach to process food and for acid levels to decrease. Heartburn can be uncomfortable, but understanding its causes can help us make informed choices. Always consult a doctor if you experience chronic heartburn.